After the surgery, John was in the recovery room. He was still intubated, so he was still asleep, but he was coming around. They were trying to awaken him. The doctor noticed, though, through some labs that his pH level was a bit low, so he was acidic. The doctor ordered to him to be given 50 milligrams of sodium bicarbonates. However, the nurse grabbed lidocaine instead and gave him 50 milligrams of lidocaine. His vitals plummet. The alarms in the room go off. Medical personnel comes to the room. They administer epinephrine. He ultimately comes around, but when he's awakened, they realize he's got left-sided paralysis and he sustained a stroke.
Welcome to the Law Talk Podcast, where we take you behind the curtains of a successful personal injury law firm. This season, attorneys at Hollis Wright will discuss several comeback stories involving real clients of the firm. Find out through specific cases and clients how the Hollis Wright attorneys turn oftentimes catastrophic injuries and situations into comeback stories. Follow along as attorneys detail various cases, including how the injury occurred, how the firm thoroughly investigated the case, how the firm provided the best possible outcome for the client, and how the client is today.
Welcome back in to the Law Talk Podcast. David Lamb along with Carter Clay from Hollis Wright. Good to see you, sir.
Good to see you, David.
You handle such a wide variety of cases. Does that mean you've been at it a long time? Is that what that means?
What do they say? Jack of all trades, master of none?
I think you're pretty good at mastering some of these. You've gotten some pretty nice settlements. What we're talking about today is very interesting because I'd heard the numbers are staggering, the number of prescriptions that we're on. There's some folks are on just a number of medications. So it kind of does make sense that mistakes can be made with that high volume, and that's what we're going to talk about today.
Absolutely, and the more prescriptions that you're on, the higher the chances are that you will be a victim of some type of medication error at some point in time. And that's what we're going to be talking about here today, because it is a significant problem throughout the medical community where people are given the wrong medicine. And what I want to say from the outset, to be clear, is we're not talking about a situation where a doctor prescribes a medicine and you have an adverse reaction and you think that the doctor should have prescribed a different medicine.
Right.
What we're talking about is the doctor prescribes medication A and you are given medication B or something that's not medication A.
All right, so just the thought of this is scary because you could really some real damage be done here. So how big of a problem is this?
It's significant through, and you wouldn't think it would occur at the pharmacy level, but it actually occurs quite frequently at the pharmacy level where a doctor prescribes a certain medicine and the pharmacist actually fills the prescription with the wrong medication, and the person takes it home and they take the wrong medication for a day, 5 days, a month, however long it is before it's discovered that they're taking the wrong medicine. But it also occurs in a hospital setting. While people are hospitalized, it also occurs quite frequently in nursing homes and assisted living facilities where nurses will come by and will give medication. In fact, I've got a case right now involving a lady at an assisted living facility who was given her neighbor's medication. And one of the medications that my client wound up taking was an antipsychotic type medication that they had given her. So it does happen.
Yeah, that's a huge mix-up. So how often have you seen that in your practice here at Hollis Wright?
It's not an everyday occurrence, but I would imagine we sign probably 3 or 4 cases a year involving medication-type errors that I've described to you here today. And then, of course, there are other personal injury law firms that are also handling these types of cases as well.
And in what types of settings are these happening? Hospitals, pharmacies?
All of the above.
Yeah. And whenever you try to specify or categorize these type cases, would they fall under negligence or malpractice, or where do they fall?
They're going to be in medical malpractice cases, which is basically just a form of negligence. You've got to establish that they breached the standard of care in some way. But one of the attractive aspects of these types of cases is that, generally speaking, you don't have to have an expert. right? Because in a lot of medical malpractice cases, you've got to have an expert to say that whoever you're suing breached the standard of care or they did something wrong. But if they're giving you the completely wrong medication, it really kind of speaks for itself, and it's generally not something that you have to have an expert to testify about.
So now you all here at Hollis Wright love a good comeback story. Now, relative to the wrong medicine, getting the wrong medicine, wrong prescription, you've got a story of a client of yours.
Yeah, I had a very interesting case quite a few years ago involving a man named John. We'll just say that for privacy purposes. But he goes in to have open heart surgery. The surgeon performs the surgery. Everything seemingly goes well. He's in the recovery area. He's still intubated. He's still asleep, but they're waiting for him to kind of wake up, and then they're going to extubate him. During that sort of transitional process, his labs are drawn. When they draw his labs, the result of the labs show that his pH level is a bit low, which means he's a bit acidic. And if you don't get the pH level in the normal range, it can cause headaches, confusion, and ultimately some serious problems. Mm-hmm. So the doctor orders that 50 milligrams of sodium bicarbonates be administered to bring his pH level back into the normal range. The nurses, they go to this, what I will call, it's called a Pyxis stand, but basically it's almost like a vending machine. And it's got all kinds of different medicines in there. And the nurse goes in to grab the sodium bicarbonates. He comes out, he goes, and he's supposed to give what's called an IV push of the sodium bicarbonate. So John had an IV, right? And a lot of times those IVs will have another component to it to where you can hook a syringe to it and you can literally inject medicine right into the bloodstream. That's what the nurse does. However, when he does that, within seconds, John's vitals plummet. The alarms are going off in the room. His pulse rate goes down, heart rate goes down. All of the medical personnel come to the room. They're trying to figure out what is going on. They immediately give him epinephrine to try and bring his vitals back up to a normal level. They ultimately do after about 10 or 15 minutes. But during that 10 or 15 minute time period, they discovered that John had actually been given 50 milligrams of lidocaine, which is an anesthetic. And that's like 10 times, if you were intending to give somebody lidocaine, it was like 7 to 10 times the recommended dosage that you would give to a patient. And unfortunately, when John wakes up, he is experiencing significant left-sided weakness, and they ultimately diagnose him with a stroke.
Oh, my goodness. All right. So was it a medication error?
Obviously, yeah. I mean, they were supposed to give him sodium bicarbonates, and they gave him lidocaine instead. And so that's, yeah, absolutely.
All right. So after that took place, what happened to John? What was...
Well, ultimately, he went through stroke protocol. He had to go through a significant amount of physical therapy and occupational therapy to learn how to walk again. He made a pretty good recovery, but he was in, I think, inpatient rehab for 3 or 4 weeks going through all of this PT and OT. He ultimately came out and he walked with a cane, and he did have some level of permanent paralysis or weakness on the left side of his body. And he came to see us for a potential lawsuit, and we wanted to help him out, so we did, and we ultimately filed a lawsuit on his behalf.
All right, so let's step aside right there on the other side. We'll pick up what happened and let you share some of the details, the bigger moments of the case. We'll do that after the break, but we're going to step aside here on the Law Talk podcast.
We hear all the time, hiring an attorney is intimidating and overwhelming. Well, at Hollis Wright, it's not. Trust me when I say our team is here to serve you, not the other way around. Let Hollis Wright tell your comeback story.
The attorneys, proudly sponsored by the law firm of Hollis Wright, are here to serve you.
When we started the show in 2011, my goal was to do what our firm does best. Help people answer questions related to real-world legal issues they have in their lives in a way that's not intimidating to talk with a lawyer. If the issue is important to you, it's equally important to us, and we're ready to talk with you at no cost.
Yeah, oftentimes people are confronting various legal issues in their lives that really run the gamut of a lot of different legal practice areas, such as bankruptcy, criminal law, civil law, such as personal injury, divorces, domestic relations. And to be able to have a show once a week that covers those practice areas and answers people's questions in those areas, that's really the main objective of the show.
We use the resources of the many lawyers at our law firm to create a plan that has a lasting impact for each person that calls or texts. And we also give back to the community at the same time. We are here to serve you, the viewer, each week on The Attorneys.
Welcome back into the Law Talk Podcast. David Lamb here, along with Carter Clay, talking about this is like a nightmare scenario for me. I mean, you're in the hospital expecting to receive one form of medication. A client of yours, you're calling him John, received erroneous medication and it impacted him terribly, a stroke.
Yeah.
Right?
Yeah.
All right, so that's whenever he shows up at Hollis, right? So tell us what happens from there.
Well, there's actually a little bit more of an interesting backstory to this. They had actually hired or retained another law firm in the Birmingham area to represent them, and this was a husband and wife, but represent him in this incident. And they had the case for a little while. Apparently, my clients became kind of dissatisfied with that representation and ultimately terminated them from being their lawyer and came to us. And so that's how we got involved in the case. But we still had to conduct some investigation a good bit because we were, I don't want to say skeptical, but they had the medical records. And so we were looking through the medical records, and there was one medical record in particular that, again, we talk about these sort of seminal moments in a case. There was one medical record in particular, which was one from the neurologist that came in to assist or help him with his stroke, diagnosed the stroke, was sort of overseeing the recovery, et cetera. And there was a handwritten note in there that indicated that he had received the wrong medication. It didn't go into all the details, but that he had received the wrong medication, and when he woke up, he was diagnosed with a stroke. So that was an important piece of the puzzle, and we ultimately wound up filing a lawsuit kind of based on that to get more information. But one of the things that I was concerned about early on is can we prove that the stroke was caused by this medication error as opposed to being caused by a complication of the open heart surgery that he had undergone. It was a significant, serious, invasive, major surgery that he had undergone, and that is a potential side effect or risk associated in general with having that type of surgery. So that was one of the critical issues that we were going to confront in the case that I was a little bit concerned about as we made our way through the lawsuit.
Is it difficult gaining access to medical records?
No, I mean, the clients can sign off on a medical authorization form, and then as long as we've got that form and we submit it to the medical provider, they're obligated under the law to provide us with the medical records. And of course, the clients themselves or the patients, even without a lawyer, they can go to the doctor's office directly and fill out a form and get their own medical records and provide those to us.
So did you all continue to investigate even after you found that report that about the wrong medication?
Yeah, the investigation, I'm going to overstate this a little bit, but the investigation really never ends until you get the case resolved, right? So even after the lawsuit was filed, we're continuing to gather information, but the cardiologist that performed the open heart surgery, his testimony was going to prove pretty critical in terms of establishing that the cause of the stroke was likely due to the medication error as opposed to it being just an unfortunate complication of the underlying surgery. And there's actually kind of an interesting story behind that.
I'd love to hear it. I bet.
So we went and we took the cardiologist deposition, and he gave me what I needed, which was, in his opinion, he thought, within a reasonable degree of medical probability, that the stroke was the result of the medication error, the administration of the 50 milligrams of lidocaine, the vitals plummeting down, which then reduced blood flow to the brain, which then caused the stroke. But he wasn't terribly strong for me. However, the defense attorney tried to attack him on that issue and got a bit aggressive. And as you can imagine, cardiologists are very proud of their work, and he was not having any of it. Okay. And he really got stronger on the causation for my client as that deposition went on. And in fact, after the deposition was over, he got up and literally walked over, patted the defense attorney on the back and said, "Sorry, man, it is what it is," and he walked out.
All right, so how did it all resolve? How did this case resolve?
Well, so we continued to litigate it. We went to mediation. We mediated the case. We had disclosed our own experts to talk about various issues in the case, and we ultimately got it resolved on his behalf. He was happy with the settlement, and we didn't have to go to trial or try the case or anything along those lines. But it really does highlight this issue and the devastating and catastrophic consequences that can come about with the wrong medication being administered.
All right, so how is John today? What's an update on him?
I haven't talked to him in a while, so I really don't know exactly how he's doing. The last time, though, he seemed to be doing fine. I mean, he was up in age at that time when he had the underlying
But he made a full recovery?
Didn't make a full recovery. He still suffered from some left-sided weakness and paralysis issues, but he was able to walk with a cane and that type of thing, and he was already in retirement, so it wasn't like it affected his job or anything like that.
All right, so what are the takeaways we can learn from this case?
I think just be diligent and pay attention. We get into a habit and we become complacent, especially at the pharmacy level. If we're going every month, once a month, to get our medication and we have 2 or 3 medications, we just assume that we're getting the medication that we're supposed to be getting. And I don't think you should make that assumption. Look for things that are off a little bit, like are the pills a different shape? Are they a different color than what they used to be? Anything like that that causes you to have some level of suspicion, either go back to the pharmacist, show them the pills. Is this what I'm supposed to be getting? Is this the medication that I've been taking for quite some time? It looks different. It doesn't look the same. They'll tell you, and they're not infallible, as you can see, and they will make mistakes. And some of these mistakes can have devastating consequences. If you wind up taking the wrong medication, it can have a real damage and impact on your life.
Yeah, with so many folks on medications, this is an important one, Carter. Yeah, you got to get this.
And I'm happy to share this with anybody out there that's willing to listen, because it will have an impact. And think about it this way: on elderly parents, right? Their cognitive abilities aren't what they used to be, and so they're not able to monitor whether they're getting the correct medication or not, and they need somebody to help them.
Yeah, you're so trusting that wherever you're getting the medication from, that you're getting what you need and what you're supposed to be getting, but. That may be a faulty assumption. Let's err on the side of caution, as they say. Carter, appreciate it.
Thank you, David.
Thanks so much for spending time with us, and thank you so much for listening as well. If you want to find out more about Carter or Hollis Wright, the law firm, you can find it at hollis-wright.com. Also, wherever you are on social media, Hollis Wright is there as well. So check them out. Just Google search or search Hollis Wright, and you'll be able to find them, track them down, learn more about this fine law firm. That'll do it for us. Thanks so much. We'll see you next time right here on the Law Talk Podcast.